AMCA Patient Care Questions, 139 questions with explained answers. Question 1. A tympanic temperature means the body temperature is measured. Option A, under the armpit. Option B, under the tongue. Option C, at the eardrum. Option D, in the rectum. The correct answer is option C, at the eardrum. Explanation. Tympanic temperature is measured at the ear canal near the tympanic membrane, also called the eardrum. Question 2. The tube of choice for glucose testing is Option A, gray top tube. Option B, red top tube. Option C, light blue top blue. Option D, lavender top tube. The correct answer is option A, gray top tube. Explanation. Gray top tubes contain additives that slow glycolysis, helping preserve glucose concentration in the specimen before laboratory analysis. Question 3. Which of the following types of filing systems requires a cross-reference files? Option A, alphabetic. Option B, subject. Option C, geographic. Option D, numeric. The correct answer is option D, numeric. Explanation. Numeric filing systems require an alphabetical cross-reference or index so staff can locate the patient's assigned number from the patient's name. Question 4. A provider withdraws from the care of a patient without reasonable notice of discharge is considered. Option A, abandonment. Option B, malpractice. Option C, negligence. Option D, slander. The correct answer is option A, abandonment. Explanation. Abandonment occurs when a provider ends the professional relationship without reasonable notice or without giving the patient a reasonable opportunity to obtain continued care. Question 5. Which of the following is the most common means of transmitting pathogens? Option A, ingesting food. Option B, blood transfusions. Option C, coughing. Option D, touching. The correct answer is option D, touching. Explanation. Hands and touch are common ways pathogens move between people and surfaces, which is why hand hygiene is one of the most important infection prevention measures. Question 6. Your patient is experiencing chest pain and has a heart rate of 132 beats per minute. You attach the electrocardiogram monitor and see a fast, regular rhythm with a round upright P wave that precedes each QRS complex. The QRS complexes are 0.1 seconds in duration. This patient is experiencing Option A, junctional escape rhythm. Option B, sinus tachycardia. Option C, complete atrioventricular heart block. Option D, idioventricular rhythm. The correct answer is option B, sinus tachycardia. Explanation. A fast regular rhythm with a normal upright P wave before every narrow QRS complex is characteristic of sinus tachycardia because the rhythm is still originating from the sinus node. Question 7. The primary purpose of wearing gloves during phlebotomy procedures is to protect the Option A, venipuncture site from contamination by the phlebotomist's hands. Option B, specimen from contamination by the phlebotomist. Option C, patient from contamination by the phlebotomist. Option D, phlebotomist from exposure to the patient's blood. The correct answer is option D, phlebotomist from exposure to the patient's blood. Explanation. Gloves provide a barrier that reduces the phlebotomist's direct skin exposure to the patient's blood and other potentially infectious material. Question 8. Cellular respiration is a function of the Option A, cell membrane. Option B, mitochondria. Option C, Golgi apparatus. Option D, nucleus. The correct answer is option B, mitochondria. Explanation. Mitochondria generate most cellular energy through aerobic cellular respiration, which is why they are often called the energy-producing structures of the cell. Question 9. Which of the following procedures is appropriate for preparing blood and other potentially infectious materials for transport? Option A, freezing the materials before transport. Option B, placing the materials in a leak-proof container during collection. Option C, decontaminating the hazardous waste container. Option D, relabellaying containers provided for waste. The correct answer is option B, placing the materials in a leak-proof container during collection. Explanation. Potentially infectious specimens must be placed in leak-resistant containers so blood or body fluid cannot escape during handling and transport. Question 10. When a person stays in the same position all the time, pressure causes the skin to Option A, become firm and dry. Option B, weaken and become necrotic. Option C, become stronger. Option D, stay pink and moist. The correct answer is option B, weaken and become necrotic. Explanation. Prolonged pressure reduces blood flow to compressed tissue, which can cause tissue injury, breakdown, and eventually necrosis. Question 11. Which of the following cannot be handled by the medical assistant? Option A, patient requesting emergency medical advice. Option B, new patient and return appointments. Option C, directions to the facility. Option D, whether or not a physician is in a certain health plan. The correct answer is option A, patient requesting emergency medical advice. Explanation. A request for emergency medical advice requires clinical assessment and decision-making beyond routine administrative handling by a medical assistant and should be escalated according to office protocol. Question 12. Health policies that concern a patient's constitutional right to privacy, informed consent and confidentiality are part of Option A, medical statutes. Option B, patient's Bill of Rights. Option C, consent laws. Option D, disclosure laws. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 13. A 45-year-old man comes in for a stress test. His resting blood pressure is 120/80. During the stress test, his blood pressure dropped to 95/55 and his skin is cold and clammy. What is the best course of action? Option A, stop for a minute, then resume. Option B, stop the test immediately. Option C, slow the test and then pick the pace back up. Option D, push forward with the test. The correct answer is option B, stop the test immediately. Explanation. A major blood pressure drop with cold, clammy skin during a stress test suggests poor tolerance and possible circulatory compromise, so the test should be stopped immediately for patient safety. Question 14. When a blood pressure cuff is deflated, the first tapping sound is the pressure. Option A, pulse. Option B, systolic. Option C, mean arterial. Option D, diastolic. The correct answer is option B, systolic. Explanation. The first Korokov sound heard while the cuff pressure falls marks the systolic pressure, which reflects arterial pressure during ventricular contraction. Question 15. There are two types of civil actions healthcare providers for injuries resulting from healthcare. The first one is lack of informed consent and the second one is Option A, violation of standard of care. Option B, trial and post-trial. Option C, violation of confidentiality. Option D, violation of continued care plan. The correct answer is option A, violation of standard of care. Explanation. A violation of the standard of care occurs when a healthcare provider fails to act with the level of skill and care expected under similar circumstances. Question 16. Tachycardia is a pathology that damages mainly the Option A, heart muscle. Option B, brain. Option C, blood vessels. Option D, body organs. The correct answer is option A, heart muscle. Explanation. The source keys heart muscle. Tachycardia means an abnormally fast heart rate and can increase cardiac workload, but the wording that it directly damages one organ should be reviewed for accuracy. Question 17. A phlebotomist enters a room to draw blood on a patient who is hospitalized with an infected wound. The site of the wound and any of its bandages are considered which link in the chain of infection. Option A, portal of exit. Option B, susceptible host. Option C, infectious agent. Option D, mode of transmission. The correct answer is option A, portal of exit. Explanation. An infected wound can release microorganisms into the environment, making the wound and contaminated drainage or dressings a portal of exit in the chain of infection. Question 18. A patient has been taking aspirin for arthritis. Which of the following is most likely to be affected by it? Option A, bleeding time. Option B, glucose time. Option C, blood culture collection. Option D, blood culture results. The correct answer is option A, bleeding time. Explanation. Aspirin inhibits platelet function, so it can prolong bleeding time and increase the tendency to bleed. Question 19. The body organ targeted by hepatitis B virus is the Option A, brain. Option B, liver. Option C, heart. Option D, lungs. The correct answer is option B, liver. Explanation. Hepatitis B virus primarily infects liver cells, so the liver is the main organ affected by the disease. Question 20. Which choice is a typical educational for elderly patients to prevent disease? Option A, the location of the patient's public health resources in their community. Option B, health anti-aging skin care techniques and products. Option C, sterile technique used in the medical practice. Option D, annual flu pneumonia vaccination information. The correct answer is option D, annual flu pneumonia vaccination information. Explanation. Vaccination education is an important preventive topic for older adults because immunization can reduce the risk of serious respiratory infections and related complications. Question 21. A patient came into the doctor's office with chest pain and shortness of breath. Which position is the best to help him breathe better? Option A, lithotomy. Option B, prone. Option C, Fowler's. Option D, supine. The correct answer is option C, Fowler's. Explanation. Fowler's position raises the head and upper body, which can improve chest expansion and make breathing easier for a patient with shortness of breath. Question 22. A monitor that a patient wears for 24 hours is called an. Option A, Holter. Option B, 12-lead. Option C, Holter. Option D, echocardiogram. The correct answer is option C, Holter. Explanation. A Holter monitor records the heart's electrical activity continuously during normal daily activities, commonly for about 24 hours or longer. Question 23. While taking a patient's medical history for active tuberculosis, what type of personal protective equipment is required? Option A, goggles. Option B, lab coat. Option C, gloves. Option D, mask. The correct answer is option D, mask. Explanation. Active tuberculosis is spread through airborne particles, so respiratory protection is required when entering or interviewing a patient with suspected or confirmed infectious tuberculosis. Question 24. Narrowing of the valve between the left atrium and the left ventricle is called. Option A, mitral stenosis. Option B, aortic stenosis. Option C, pulmonary stenosis. Option D, tricuspid stenosis. The correct answer is option A, mitral stenosis. Explanation. Mitral stenosis is narrowing of the mitral valve, which lies between the left atrium and left ventricle. Question 25. Which of the following is the best specimen to test for levels of iron in the blood? Option A, the one collected in a tube that contains sodium citrate. Option B, the one collected in a microcuvette. Option C, the one collected in the tube that contains ethylenediamine tetrashic acid. Option D, the one collected in a tube with no additive. The correct answer is option C, the one collected in the tube that contains ethylenediamine tetrashic acid. Explanation. The source keys the tube containing ethylenediamine tetrashic acid. Because iron testing methods can depend on the laboratory protocol, this item should be checked against the specific course or laboratory standard being used. Question 26. A patient has a possible corneal abrasion and needs a referral. Which specialty is a physician that deals with eye injury and disease? Option A, ophthalmologist. Option B, oncologist. Option C, optician. Option D, optometrist. The correct answer is option A, ophthalmologist. Explanation. An ophthalmologist is a physician who diagnoses and treats eye diseases and injuries and can provide medical and surgical eye care. Question 27. Which of the following is an example of negative kinesics? Option A, smiling. Option B, eye contact. Option C, frowning. Option D, good grooming. The correct answer is option C, frowning. Explanation. Kinesics refers to body movement and nonverbal expression. Frowning communicates a negative nonverbal message. Question 28. Protected health information stands for. Option A, protected health information. Option B, private health instructions. Option C, private health information. Option D, protected health instructions. The correct answer is option A, protected health information. Explanation. Protected health information is individually identifiable health information that is protected by privacy rules when handled by covered healthcare organizations and their business associates. Question 29. Coinsurance is calculated based on A. Option A, a capitation rate. Option B, percentage of charge. Option C, a fixed charge for each visit. Option D, number of policyholders in the plan. The correct answer is option B, percentage of charge. Explanation. Coinsurance is the portion of an allowed charge that the insured person pays as a percentage after applicable plan rules are met. Question 30. One method to calculate heart rate from an electrocardiogram strip is to. Option A, count the small boxes between the R to R interval and divide by 1,500. Option B, count the number of small boxes in the R to R intervals and divide by 2. Option C, estimate by counting R peaks in 10-second strip and multiply by 10. Option D, count the number of QRS complexes in a 3-strip and multiply by 10. The correct answer is option A, count the small boxes between the R to R interval and divide by 1,500. Explanation. At a paper speed of 25 mm per second, dividing 1,500 by the number of small boxes between consecutive R waves estimates the heart rate for a regular rhythm. Question 31. One example of a physiologic response to negative stress is. Option A, headache. Option B, high energy. Option C, sleep deprivation. Option D, upset stomach. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 32. Which limb sensor is the reference or ground electrode? Option A, right arm. Option B, left arm. Option C, left leg. Option D, right leg. The correct answer is option D, right leg. Explanation. The right leg sensor serves as the reference or ground electrode in the standard electrocardiogram limb electrode arrangement. Question 33. Which is an example of a recommended preventive procedure? Option A, eating the recommended daily allowances. Option B, teeth whitening. Option C, childhood immunizations. Option D, daily exercise. The correct answer is option C, childhood immunizations. Explanation. Childhood immunizations are preventive because they reduce the risk of developing specific infectious diseases before illness occurs. Question 34. Which of the following is known as swimmer's ear? Option A, otitis externa. Option B, otitis. Option C, otitis media. Option D, otitis interna. The correct answer is option A, otitis externa. Explanation. Otitis externa is inflammation or infection of the external ear canal and is commonly called swimmer's ear. Question 35. Another name for chest leads is option A, standard. Option B, precordial. Option C, limb. Option D, augmented. The correct answer is option B, precordial. Explanation. Precordial leads are the chest leads placed across the front of the chest to view electrical activity from different horizontal angles. Question 36. Which of the following skills would not be an appropriate expectation of the competent medical assistant? Option A, giving instructions to patients about self-care after treatments. Option B, diagnosing common patient symptoms. Option C, performing insurance coding and billing. Option D, using the computer to perform a variety of office functions. The correct answer is option B, diagnosing common patient symptoms. Explanation. Diagnosing symptoms is a provider-level clinical responsibility and is not an appropriate independent duty for a medical assistant. Question 37. Faithfulness, or allegiance to a cause, ideal, custom, institution or product, is called option A, loyalty. Option B, dependability. Option C, courtesy. Option D, flexibility. The correct answer is option A, loyalty. Explanation. Loyalty means faithfulness or allegiance to a person, organization, cause, or principle. Question 38. Which of the following types of gloves can be decontaminated and reused if they show no signs of deterioration after use? Option A, disposable. Option B, utility. Option C, sterile. Option D, examination. The correct answer is option B, utility. Explanation. Utility gloves are heavy-duty reusable gloves that may be cleaned and decontaminated if they remain intact and show no signs of deterioration. Question 39. Hypotension is defined as option A, no measurable systolic pressure. Option B, systolic pressure above 150 mm of mercury and diastolic pressure above 90 mm of mercury. Option C, systolic pressure of 129 mm of mercury and diastolic pressure of 80 mm of mercury. Option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. The correct answer is option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. Explanation. The source defines hypotension as a systolic pressure below 90 and a diastolic pressure below 60 mm of mercury. Clinical interpretation also depends on symptoms and the patient's baseline. Question 40. Identify the following rhythm. Option A, atrial fibrillation. Option B, ventricular fibrillation. Option C, junctional tachycardia. Option D, asystole. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 41. A pounding or racing of the heart, such that the patient is aware of his and her heartbeat is called a and an. Option A, palpitation. Option B, ectopic beat. Option C, hemoptysis. Option D, arrhythmia. The correct answer is option A, palpitation. Explanation. A palpitation is the sensation of being aware of a forceful, rapid, irregular, or pounding heartbeat. Question 42. Complete destruction of all forms of microbial life. Option A, sterilization. Option B, germicide. Option C, sanitization. Option D, disinfection. The correct answer is option A, sterilization. Explanation. Sterilization destroys all forms of microbial life, including bacterial spores, which distinguishes it from cleaning and most disinfection processes. Question 43. Which of the following vacutainer tubes is routinely used for hematology testing? Option A, light blue top tubes. Option B, red top tubes. Option C, lavender top tubes. Option D, green top tubes. The correct answer is option C, lavender top tubes. Explanation. Lavender top tubes contain ethylenediamine tetrashic acid, which preserves blood cell morphology and is widely used for hematology tests such as a complete blood count. Question 44. Asystole. Option A is defined as the presence of chaotic cardiac activity. Option B produces a complete cessation of cardiac output. Option C is the most common primary event in cardiac arrest in the adult. Option D appears as a chaotic line on the electrocardiogram monitor. The correct answer is option B, produces a complete cessation of cardiac output. Explanation. Asystole means the absence of effective ventricular electrical activity and therefore no effective cardiac output. Question 45. The invoice for the monthly rent of the building where the medical office is located is typically handled by which department? Option A, compliance. Option B, human resources. Option C, accounts payable. Option D, accounts receivable. The correct answer is option C, accounts payable. Explanation. Accounts payable handles money the medical office owes to others, such as rent, utilities, and vendor invoices. Question 46. The patient has been given a prescription that says the medication should be taken twice daily. This medication should be taken, option A, before bedtime. Option B, once a day. Option C, before meals. Option D, twice a day. The correct answer is option D, twice a day. Explanation. Twice daily means the medication is taken 2 times during the day at the intervals directed by the prescriber. Question 47. Which situation would a medical assistant's signature be required? Option A, after the chief complaint is documented. Option B, after the patient gives a medical history account. Option C, on an informed consent document. Option D, when a patient gives implied consent. The correct answer is option C, on an informed consent document. Explanation. An informed consent document requires signatures to show that the consent process was completed and documented according to office policy and legal requirements. Question 48. What is the best sample for the determination of blood pH and blood gases? Option A, cerebrospinal fluid. Option B, arterial blood. Option C, venous blood. Option D, capillary blood. The correct answer is option B, arterial blood. Explanation. Arterial blood is preferred for blood gas testing because it best reflects oxygenation, ventilation, and acid-base status after gas exchange in the lungs. Question 49. A patient's weight should be listed in the patient's chart to the nearest. Option A, pound. Option B, 1/2 pound. Option C, ounce. Option D, 1/4 pound. The correct answer is option D, 1/4 pound. Explanation. The source keys 1/4 pound as the charting precision. This is a documentation convention from the source and should be matched to the policy or equipment standard used in the course. Question 50. If a finger is excessively milked during a skin puncture, the result will be: Option A, a decrease in pain for the patient. Option B, increased venous blood flow to the puncture site. Option C, an adequate of blood for filling several capillary tubes. Option D, hemolysis and contamination of the specimen with tissue fluids. The correct answer is option D, hemolysis and contamination of the specimen with tissue fluids. Explanation. Excessive squeezing of a puncture site can damage blood cells and mix tissue fluid with the sample, causing hemolysis and dilution or contamination of the specimen. Question 51. Information given by a patient to medical personnel that cannot be disclosed without consent constitutes: Option A, duty of care. Option B, negligence. Option C, judgment. Option D, privileged communication. The correct answer is option D, privileged communication. Explanation. Privileged communication is confidential information shared within a protected professional relationship and is not normally disclosed without authorization or another lawful basis. Question 52. The acronym used to remember the actions to take when using a fire extinguisher is: Option A, ACT. Option B, help. Option C, rescue, alarm, confine, and extinguish or evacuate. Option D, pull the pin, aim at the base, squeeze the handle, and sweep side to side. The correct answer is option D, pull the pin, aim at the base, squeeze the handle, and sweep side to side. Explanation. The fire extinguisher sequence is pull the pin, aim at the base of the fire, squeeze the handle, and sweep side to side so the extinguishing agent is directed effectively. Question 53. The physician prescribes a buccal medication. The medical assistant should instruct the patient to: option A, place the medication between the lower teeth and cheek. Option B, chew the medication and swallow it. Option C, place the medication under the tongue. Option D, dissolve the medication in water and drink it. The correct answer is option A, place the medication between the lower teeth and cheek. Explanation. A buccal medication is designed to dissolve between the cheek and gum so the drug can be absorbed through the lining of the mouth. Question 54. Choose the answer that corresponds with letter B. Option A, brachial artery. Option B, cephalic vein. Option C, ulnar artery. Option D, radial artery. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 55. A female patient came into the emergency room due to vaginal bleeding. What is the name of the instrument used to hold open the wall of the vagina? Option A, retractor. Option B, speculum. Option C, hemostat. Option D, forceps. The correct answer is option B, speculum. Explanation. A speculum is used to separate and hold open the vaginal walls so the cervix and vaginal canal can be examined. Question 56. Samples appear to have been mislabeled and mixed on 2 patients. Each outpatient has orders for both blood and urine test, so there were 2 samples for each. What would be the best course of action? Option A, recollect all 4 specimens from the patients. Option B, relabel the urine samples, but redraw the blood. Option C, have the patients come back and identify their specimens. Option D, relabel all the specimens. The correct answer is option A, recollect all 4 specimens from the patients. Explanation. When patient specimens may be mislabeled, the safest action is to reject the questionable specimens and recollect them using correct identification procedures rather than guess which sample belongs to whom. Question 57. The amount that an insurance company may say is not allowed and not the responsibility of the patient, for a contracted physician, would be identified as this on the patient's account. Option A, a payment. Option B, an adjustment. Option C, a charge. Option D, a deductible. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 58. Aspirin and acetaminophen are examples of: option A, analgesics and antipyretics. Option B, antitussives and decongestants. Option C, antihistamines and antiemetics. Option D, antidotes and antibiotics. The correct answer is option A, analgesics and antipyretics. Explanation. Aspirin and acetaminophen reduce pain and can lower fever, which makes them analgesic and antipyretic medications. Question 59. A physician, specialist or any person that provides medical care is known as the: option A, provider. Option B, policyholder. Option C, subscriber. Option D, dependent. The correct answer is option A, provider. Explanation. A provider is a healthcare professional or organization that supplies medical services to patients. Question 60. After a patient interview by the medical assistant, which of the following should not be recorded by the medical assistant? Option A, family medical history. Option B, examination narrative. Option C, chief complaint. Option D, medication allergies. The correct answer is option B, examination narrative. Explanation. The medical assistant may document information obtained during the interview, but the provider's examination narrative belongs to the provider's clinical examination and should not be independently created by the assistant. Question 61. Regulation of the heart rate, speed of electrical conduction and strength of contraction are influenced by the brain via the nervous system. Option A, autonomic. Option B, somatic. Option C, core. Option D, voluntary. The correct answer is option A, autonomic. Explanation. The autonomic nervous system regulates involuntary cardiac functions such as heart rate, conduction speed, and force of contraction through sympathetic and parasympathetic influences. Question 62. What is the name of the law that protects healthcare workers who gave aid during the time of an accident? Option A, Good Samaritan Law. Option B, Megan's Law. Option C, Right to Know Law. Option D, Health Insurance Portability and Accountability Act. The correct answer is option A, Good Samaritan Law. Explanation. Good Samaritan laws are intended to provide certain legal protections to people who voluntarily give emergency assistance in good faith, although the exact protections vary by jurisdiction. Question 63. What is the name of the heart valve that separates the right atrium and right ventricle and? Option A, aortic valve. Option B, tricuspid valve. Option C, pulmonic valve. Option D, mitral valve. The correct answer is option B, tricuspid valve. Explanation. The tricuspid valve lies between the right atrium and right ventricle and prevents backward flow into the atrium during ventricular contraction. Question 64. A female patient came into the emergency room with her husband. She was suffering from severe shortness of breath. She appeared to be unable to take in sufficient oxygen. What is the color of the skin and nail beds? Option A, brownish. Option B, greenish. Option C, reddish. Option D, bluish. The correct answer is option D, bluish. Explanation. Bluish discoloration of the skin or nail beds can indicate cyanosis, which occurs when the blood contains an increased amount of deoxygenated hemoglobin. Question 65. The ability to identify with someone else's feelings is called: option A, respect. Option B, feedback. Option C, sympathy. Option D, empathy. The correct answer is option D, empathy. Explanation. Empathy is the ability to understand and identify with another person's feelings while maintaining an appropriate professional perspective. Question 66. Notifiable infection must be reported to: option A, the patient's physician. Option B, your supervisor. Option C, World Health Organization. Option D, Center for Disease Control. The correct answer is option D, Center for Disease Control. Explanation. The source keys the Centers for Disease Control and Prevention. In practice, reporting usually follows state or local public health rules, so this item should be checked against the jurisdiction and course standard being taught. Question 67. To indicate that something lies nearer the surface, use the term: option A, distal. Option B, deep. Option C, superficial. Option D, proximal. The correct answer is option C, superficial. Explanation. Superficial means closer to or at the body surface, while deep describes a structure farther from the surface. Question 68. Somatic tremor is the result of: option A, muscle movement. Option B, loose sensors. Option C, unequal amounts of electrolytes. Option D, improper standardization of the instrument. The correct answer is option A, muscle movement. Explanation. Somatic tremor is an electrocardiogram artifact caused by skeletal muscle movement, such as shivering, tension, or patient motion during the recording. Question 69. Which of the following specimens are best utilized to measure clotting factors? Option A, serum. Option B, whole blood. Option C, plasma. Option D, sterile blood. The correct answer is option C, plasma. Explanation. Plasma is used for many clotting factor tests because the specimen retains clotting proteins when blood is collected with the correct anticoagulant. Question 70. What is the process used to wash and remove blood and tissue from medical instruments called? Option A, asepsis. Option B, sanitization. Option C, disinfection. Option D, sterilization. The correct answer is option B, sanitization. Explanation. Sanitization is the cleaning step that removes visible soil, blood, and tissue from instruments before higher-level disinfection or sterilization when required. Question 71. A round, raised skin lesion with itching that is a positive sign of reaction to allergic testing is A. Option A, wheal. Option B, nodule. Option C, papule. Option D, vesicle. The correct answer is option C, papule. Explanation. The source keys papule, but allergy skin testing is commonly described as positive when a wheal develops. This item should be reviewed because the supplied key and standard terminology may not agree. Question 72. Is usually sponsored and partially paid by an employer. Option A, TRICARE. Option B, private insurance. Option C, workers' aid. Option D, group health insurance. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 73. The patient information sheet contains: option A, the past medical history of the patient. Option B, the patient's past family history. Option C, the patient's chief complaint. Option D, patient's personal and insurance information. The correct answer is option D, patient's personal and insurance information. Explanation. The patient information sheet is used to collect identifying, contact, and insurance information needed for registration, billing, and communication. Question 74. All pathogens are: Option A, microorganisms that live in soil. Option B, microbes that can cause disease. Option C, communicable microorganisms. Option D, normal bacteria found on skin. The correct answer is option B, microbes that can cause disease. Explanation. A pathogen is a microorganism or other infectious agent capable of causing disease in a host. Question 75. The information of blood cells is defined as: Option A, hematopoiesis. Option B, erythropoietin. Option C, mean corpuscular volume. Option D, hemoglobinopathy. The correct answer is option A, hematopoiesis. Explanation. Hematopoiesis is the process by which blood cells are formed and developed, mainly in the bone marrow after birth. Question 76. The functional unit of the kidney is the: Option A, nephron. Option B, ureter. Option C, urethra. Option D, bladder. The correct answer is option A, nephron. Explanation. The nephron is the microscopic functional unit of the kidney that filters blood and helps form urine. Question 77. A structure that is composed of two or more tissue types is called a and an. Option A, system. Option B, organism. Option C, organ. Option D, cell. The correct answer is option C, organ. Explanation. An organ is made of two or more tissue types that work together to perform specific functions. Question 78. An obese patient was sent to the laboratory for a complete blood count. Which of the following veins is MOT likely to be the only that the phlebotomist can palpate? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, sclerosed vein. The correct answer is option B, cephalic vein. Explanation. The cephalic vein lies along the outer side of the arm and may be easier to palpate in some patients when deeper veins are difficult to locate. Question 79. When performing a dermal puncture and the lancet hits the bone, what is the potentially serious fatal bone infection that could occur? Option A, osteochondritis. Option B, osteomyelitis. Option C, osteomalacia. Option D, osteoporosis. The correct answer is option B, osteomyelitis. Explanation. Osteomyelitis is an infection of bone. A lancet that penetrates too deeply during a dermal puncture can potentially introduce infection near the bone. Question 80. Which of the patient's limbs serves as an electrical ground? Option A, right arm. Option B, left leg. Option C, left arm. Option D, right leg. The correct answer is option D, right leg. Explanation. In a standard electrocardiogram setup, the right leg electrode serves as the reference or ground electrode and is not used to form the main diagnostic limb leads. Question 81. What is the function of the large intestine, also known as colon? Option A, absorb water. Option B, absorb sugar. Option C, absorb fat. Option D, absorb vitamins. The correct answer is option A, absorb water. Explanation. The large intestine absorbs water and electrolytes from intestinal contents and helps form and store feces. Question 82. No anticoagulants are found in which of the following tubes? Option A, green-topped. Option B, yellow-topped. Option C, lavender-topped. Option D, red-topped. The correct answer is option D, red-topped. Explanation. A plain red-topped tube traditionally contains no anticoagulant, allowing the blood to clot so serum can be separated after centrifugation. Question 83. A 67-year-old man comes into the doctor's office for a regular checkup. The doctor orders an electrocardiography to be done on the patient. There is junctional escape beat noticed by you. What is the origin of this rhythm? Option A, atrioventricular node. Option B, bundle branches. Option C, ventricle. Option D, sinus node. The correct answer is option A, atrioventricular node. Explanation. A junctional escape beat originates in tissue near the atrioventricular junction when the normal pacemaker fails to fire or its impulse does not reach the ventricles. Question 84. When the body has had adequate rest and no food for at least 12 hours, it is said to be in: Option A, hemostasis. Option B, basal state. Option C, homeostasis. Option D, steady state. The correct answer is option B, basal state. Explanation. Basal state describes the body after adequate rest and fasting, when metabolic activity is measured under relatively standardized resting conditions. Question 85. Normal sinus rhythm has a heart rate of beats per minute. Option A, 80 to 120. Option B, 50 to 75. Option C, 60 to 100. Option D, 40 to 60. The correct answer is option C, 60 to 100. Explanation. Normal sinus rhythm is commonly defined as a regular sinus rhythm with a rate from 60 to 100 beats per minute in an adult. Question 86. Mr. Smith is suffering from an enlargement of the bones in the entire skull as well as in the hands and feet, in addition to thickening of the skin. Which of the following conditions is Mr. Smith suffering from? Option A, Addison's. Option B, Cushing's. Option C, acromegaly. Option D, cretinism. The correct answer is option C, acromegaly. Explanation. Acromegaly results from excess growth hormone after the growth plates have closed, producing enlargement of the hands, feet, facial bones, and soft tissues. Question 87. Most specialists are paid by managed care organizations using which of the following methods? Option A, fee-for-service. Option B, coinsurance. Option C, copayment. Option D, capitation. The correct answer is option A, fee-for-service. Explanation. Fee-for-service reimburses the specialist for individual services performed rather than paying a fixed amount per enrolled patient. Question 88. Which of the following precautions require special air handling and ventilation? Option A, contact precautions. Option B, standard precautions. Option C, airborne precautions. Option D, droplet precautions. The correct answer is option C, airborne precautions. Explanation. Airborne precautions require special ventilation because very small infectious particles can remain suspended in the air and travel beyond the immediate patient area. Question 89. A collection tube containing an anticoagulant must be inverted how many times? Option A, tubes containing anticoagulants are not inverted at all. Option B, 10 times. Option C, 8 times. Option D, shake vigorously for 30 seconds. The correct answer is option C, 8 times. Explanation. Anticoagulant tubes are gently inverted several times so blood mixes evenly with the additive and small clots do not form. The source specifies 8 inversions for this item. Question 90. Two premature ventricular complexes in a row are called A and N of premature ventricular complexes. Option A, deuce. Option B, couplet. Option C, bigemini. Option D, double. The correct answer is option B, couplet. Explanation. Two premature ventricular complexes occurring consecutively are called a couplet. Question 91. Dr. Jones and Dr. Brown decide to share a practice. Together, they share patients, expenses, profits, and assets. Which type of medical practice is this? Option A, group practice. Option B, clinic. Option C, partnership. Option D, sole proprietorship. The correct answer is option A, group practice. Explanation. A group practice is formed when multiple physicians practice together and share resources such as patients, expenses, income, and facilities. Question 92. What is the correct way to calculate pulse pressure? Option A, the number found when subtracting the diastolic from the systolic. Option B, the sum of the diastolic and the systolic. Option C, the pulse taken at the carotid location. Option D, the pulse taken at the apical location. The correct answer is option A, the number found when subtracting the diastolic from the systolic. Explanation. Pulse pressure is calculated by subtracting the diastolic pressure from the systolic pressure, which shows the pressure difference between heart contraction and relaxation. Question 93. Identify the tubes needed to collect a prothrombin time, immediate electrolytes, and blood culture in the proper order of collection. Option A, yellow, light blue, plasma separator tube. Option B, serum separator tube, yellow, light blue. Option C, light blue, lavender, yellow. Option D, gold, yellow, light blue. The correct answer is option A, yellow, light blue, plasma separator tube. Explanation. The keyed sequence places the blood culture collection first, followed by the light blue coagulation tube and then the plasma separator tube for electrolytes. Question 94. Before developing a medication schedule, you should evaluate the patient's. Option A, bathroom habits. Option B, medical record. Option C, daily routine. Option D, side effects. The correct answer is option C, daily routine. Explanation. A medication schedule is more likely to be followed when it fits the patient's normal daily routine, such as waking, meals, work, and bedtime. Question 95. Thixotropic gel, found in the serum separator tube red-gray marbled-topped vacutainer tube. Option A, is more dense than red blood cells and less dense than white blood cells. Option B, is more dense than red blood cells and less dense than serum. Option C, is less dense than red blood cells but more dense than serum. option D, has the same density as red blood cells? The correct answer is option C, is less dense than red blood cells but more dense than serum. Explanation. During centrifugation, separator gel moves between the denser blood cells and the less dense serum, creating a stable physical barrier between them. Question 96. The normal volume of urine produced by an adult in a 24-hour period generally does not exceed, option A, 2,000 liters, option B, 2,000 milliliters, option C, 400 milliliters, option D, 750 milliliters. The correct answer is option B, 2,000 milliliters. Explanation. The source uses about 2,000 milliliters as the upper end of typical daily adult urine output, although normal output varies with intake and clinical condition. Question 97. Choose the answer that corresponds with letter F. Option A, basilic vein. Option B, medicancubital vein. Option C, radial artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 98. Which of the following tests is not a part of complete blood count? Option A, activated partial thromboplastin time. Option B, differential. Option C, hemoglobin. Option D, hematocrit. The correct answer is option A, activated partial thromboplastin time. Explanation. Activated partial thromboplastin time is a coagulation test, not a component of the complete blood count, which evaluates blood cells and related indices. Question 99. The principal advantage of using wave method when designing the scheduling process is that it, option A, provides more breaks for staff. Option B, allows flexibility to accommodate the unpredictable. Option C, gives priority to established patients. Option D, enables the physician to see more patients each day. The correct answer is option B, allows flexibility to accommodate the unpredictable. Explanation. Wave scheduling builds flexibility into the schedule by grouping several patients near the same time so the office can absorb delays, variable visit lengths, and unexpected events. Question 100. When medical assistants are able to adapt to various situations, they are considered to be option A, courteous, option B, flexible, option C, dependable, option D, loyal. The correct answer is option B, flexible. Explanation. Flexibility is the ability to adjust behavior or plans when circumstances change, which is important in a busy medical office. Question 101. The correct lead from the right arm to the leg is option A, augmented voltage right arm lead, option B, augmented voltage foot lead, option C, lead 3, option D, lead 2. The correct answer is option D, lead 2. Explanation. Standard limb lead 2 records the electrical potential from the negative right arm electrode toward the positive left leg electrode. Question 102. The smallest structural unit of the nervous system is the option A, spinal cord, option B, neurofibrils, option C, neuron, option D, supine. The correct answer is option C, neuron. Explanation. The neuron is the basic structural and functional cell of the nervous system because it receives, processes, and transmits nerve signals. Question 103. The interval between exposure to infection and the appearance of the first symptom is called option A, incubation period, option B, active period, option C, means of transmission period, option D, incineration period. The correct answer is option A, incubation period. Explanation. The incubation period is the time between exposure to an infectious agent and the appearance of the first signs or symptoms of disease. Question 104. Identify the rhythm that will often produce an irregular rhythm. Option A, atrial tachycardia. Option B, sinus dysrhythmia. Option C, ventricular tachycardia. Option D, sinus bradycardia. The correct answer is option B, sinus dysrhythmia. Explanation. Sinus dysrhythmia produces a rhythm that varies with the respiratory cycle, so the intervals between beats can appear irregular while the impulses still originate in the sinus node. Question 105. A fluctuating fever that returns to or below baseline then increases again is option A, intermittent, option B, remittent, option C, onset, option D, continuous. The correct answer is option A, intermittent. Explanation. An intermittent fever returns to normal or below the fever threshold between episodes before rising again. Question 106. Which of the following supplies blood to the heart muscle? Option A, coronary arteries. Option B, brachial arteries. Option C, carotid arteries. Option D, cerebral arteries. The correct answer is option A, coronary arteries. Explanation. The coronary arteries branch from the aorta and deliver oxygenated blood directly to the heart muscle. Question 107. Which of the following statements is true under the doctrine of respondeat superior? Option A. The physician is responsible for any errors made by the medical staff. Option B. The person who has been employed for the longest period of time is responsible for any errors made by the medical staff. Option C. The medical administrative assistant is responsible for any errors made by the medical staff. Option D. The medical administrative assistant is superior to other members of the medical staff. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 108. What does this symbol represent? Option A, chemical hazard. Option B, biologic hazard. Option C, radioactive hazard. Option D, Sharp's hazard. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 109. The layer of the heart that is responsible for contraction and relaxation is known as the Option A, pericardium. Option B, myocardium. Option C, endocardium. Option D, epicardium. The correct answer is option B, myocardium. Explanation. The myocardium is the thick muscular middle layer of the heart wall and generates the force needed for cardiac contraction. Question 110. Which of the following is an example of proxemics? Option A, eye contact. Option B, facial expression. Option C, personal contact. Option D, personal hygiene. The correct answer is option B, facial expression. Explanation. The source keys facial expression, but proxemics concerns the use of personal space and physical distance in communication. This item should be reviewed because the supplied key appears inconsistent with standard terminology. Question 111. What is the appropriate test used for heparin therapy? Option A, point-of-care testing. Option B, activated partial thromboplastin time. Option C, hemoglobin and hematocrit. Option D, serum separator tube. The correct answer is option B, activated partial thromboplastin time. Explanation. Activated partial thromboplastin time is commonly used to evaluate the effect of unfractionated heparin on the blood clotting process. Question 112. The Q wave, if present, is always Option A, positive. Option B, present. Option C, isoelectric. Option D, negative. The correct answer is option D, negative. Explanation. A normal Q wave, when present, is the first negative deflection of the Q or S complex before the first positive R wave. Question 113. The privacy rule gives patients the right to Option A, access their medical record. Option B, access their ex-spouse's record. Option C, sue the doctor. Option D, refuse treatment. The correct answer is option A, access their medical record. Explanation. The privacy rule gives patients important rights over their health information, including the right to inspect or obtain copies of much of their medical record. Question 114. A quantitative test is one that Option A, tests for the presence and amount of substance in sample. Option B, tests for presence of substance only. Option C, does not require a trained technician. Option D, tests for all substances found in the sample. The correct answer is option A, tests for the presence and amount of substance in sample. Explanation. A quantitative test reports how much of a substance is present, while a qualitative test generally reports whether the substance is present or absent. Question 115. The medical assistant is to collect a prothrombin time test, a complete blood count, and a fasting blood sugar. What is the correct order of draw? Option A, gray fasting blood sugar, lavender prothrombin time, red complete blood count. Option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Option C, lavender fasting blood sugar, red complete blood count, green prothrombin time. Option D, gray fasting blood sugar, lavender complete blood count, light blue prothrombin time. The correct answer is option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Explanation. The keyed order places the light blue coagulation tube before the lavender hematology tube and the gray glucose tube, which follows the source's order of draw sequence for these specimens. Question 116. Choose the answer that corresponds with number D. Option A, ulnar artery. Option B, radial artery. Option C, brachial artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 117. Name this part of the electrocardiogram. Option A, R-to-R interval. Option B, ST segment. Option C, PR segment. Option D, QRS complex. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 118. Which is the most common route of administration of nitroglycerin? Option A, intravenous. Option B, intradermal. Option C, suppository. Option D, sublingual. The correct answer is option D, sublingual. Explanation. Sublingual nitroglycerin is placed under the tongue for rapid absorption, which allows a quick effect when it is prescribed for acute angina symptoms. Question 119. Family members, such as spouse or children that are covered under the member's insurance policy are known as Option A, members. Option B, beneficiaries. Option C, dependents. Option D, subscribers. The correct answer is option C, dependents. Explanation. Dependents are eligible family members, such as a spouse or children, who receive coverage under the insured person's health plan according to the plan's rules. Question 120. The National Health Insurance Plan for Americans age 65 and older is Option A, Civilian Health and Medical Program of the Department of Veterans Affairs. Option B, Medicaid. Option C, TRICARE. Option D, Medicare. The correct answer is option D, Medicare. Explanation. Medicare is the federal health insurance program that primarily covers people age 65 and older and also covers certain younger people who meet eligibility criteria. Question 121. Two employees discussing a patient diagnosis on a hospital elevator with other people present is a violation of Option A, patient rights. Option B, patient privacy. Option C, patient confidentiality. Option D, patient insurance. The correct answer is option C, patient confidentiality. Explanation. Discussing a patient's diagnosis where unauthorized people can hear it exposes confidential health information and violates the duty to protect patient confidentiality. Question 122. Which drug is used as an anticoagulant? Option A, fluoxetine Prozac. Option B, warfarin Coumadin. Option C, digoxin Lanoxin. Option D, triazolam halcion. The correct answer is option B, warfarin Coumadin. Explanation. Warfarin is an anticoagulant that reduces formation of vitamin K-dependent clotting factors and is used to reduce the risk of harmful blood clots. Question 123. The best way to handle a difficult or bad patient is to Option A, threaten to report the patient to his or her doctor. Option B, speak firmly to maintain charge of the situation. Option C, help the patient to feel in control of the situation. Option D, leave the room without collecting the specimen. The correct answer is option C, help the patient to feel in control of the situation. Explanation. Helping an upset patient feel some control can reduce confrontation and improve cooperation while the medical assistant maintains clear professional boundaries and safety. Question 124. While Mr. Dillon's hematocrit is spinning in the centrifuge, you perform an automated hemoglobin test on a sample of his blood and record the value as 15 grams per deciliter. You do a quick mental calculation and expect that the hematocrit value will be approximately Option A, 5 grams per deciliter. Option B, 5%. Option C, 45%. Option D, 45 grams per deciliter. The correct answer is option C, 45%. Explanation. A common screening estimate is that hematocrit is about 3 times the hemoglobin value, so a hemoglobin of 15 grams per deciliter suggests a hematocrit near 45%. Question 125. When using a number 10 envelope, where should the address be placed? Option A, 10 lines down from the top and 4 inches from the left edge of the envelope. Option B, 14 lines down from the top and 2 inches from the left edge of the envelope. Option C, 10 lines down from the top and 2 inches from the left edge of the envelope. Option D, 14 lines down from the top and 4 inches from the left edge of the envelope. The correct answer is option C, 10 lines down from the top and 2 inches from the left edge of the envelope. Explanation. The keyed placement centers the delivery address in the standard address area of a number 10 envelope so automated postal equipment can read it properly. Question 126. What drug enhances the effects of another drug? Option A, narcotic. Option B, antagonist. Option C, trade. Option D, synergistic. The correct answer is option D, synergistic. Explanation. A synergistic drug interaction occurs when one drug increases or enhances the effect of another drug. Question 127. The 4 symptoms of inflammation are erythema, edema, pain, and option A, irritation. Option B, vomiting. Option C, heat. Option D, headache. The correct answer is option C, heat. Explanation. The classic local signs of inflammation include redness, swelling, pain, and heat caused by increased blood flow and inflammatory activity in the affected area. Question 128. What drug prevents the action of another drug or chemical? Option A, trade. Option B, narcotic. Option C, synergist. Option D, antagonist. The correct answer is option D, antagonist. Explanation. An antagonist blocks or reduces the action of another drug or chemical by opposing its effect at a receptor or through another mechanism. Question 129. When using a ventrogluteal approach to give an intramuscular injection in the buttock area, what is the muscle the medication goes in? Option A, gluteus maximus. Option B, gluteus medius. Option C, right upper and outer quadrant. Option D, gluteus minimus. The correct answer is option B, gluteus medius. Explanation. The ventrogluteal intramuscular site overlays the gluteus medius and is selected because it provides a thick muscle mass away from major nerves and blood vessels. Question 130. The insurance carrier is allowed to use any method to determine the amount for a service, also known as the option A, fee schedule. Option B, deductible. Option C, allowed amount. Option D, insurance premium. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 131. A baby's pulse and respirations are: option A, the same as adults. Option B, not significantly different than an adult. Option C, faster than an adult's. Option D, slower than an adult's. The correct answer is option C, faster than an adult's. Explanation. Infants normally have faster heart rates and respiratory rates than adults because of their smaller body size and higher metabolic demand. Question 132. A normal resting heart rate for the average adult is: option A, 15-20 beats per minute. Option B, 80-120 beats per minute. Option C, 10-15 beats per minute. Option D, 60-100 beats per minute. The correct answer is option D, 60-100 beats per minute. Explanation. A normal resting adult heart rate is commonly taught as 60 to 100 beats per minute, with individual variation based on age, fitness, medications, and health status. Question 133. When a patient fails to show for their appointment, the event must be: option A, erased from the schedule. Option B, written on a no-show log. Option C, monetarily charged to the patient. Option D, documented in the patient's chart. The correct answer is option D, documented in the patient's chart. Explanation. Documenting a missed appointment creates a clear record that the patient did not attend and supports follow-up, continuity, and risk management. Question 134. How do you know when you have achieved adequate ventilation for a patient when doing cardiopulmonary resuscitation? Option A, air escapes the nose. Option B, air enters the stomach. Option C, rise of the chest. Option D, you hear a popping sound. The correct answer is option C, rise of the chest. Explanation. Visible chest rise shows that enough air is entering the lungs to expand the chest during rescue ventilation. Question 135. To determine our ventricular pulse, the electrocardiogram technician would: option A, calculate the ST repolarization segments. Option B, calculate the spacing between the P waves. Option C, calculate the spacing between the ventricular repolarization T waves. Option D, calculate the spacing between the QRS complexes. The correct answer is option D, calculate the spacing between the QRS complexes. Explanation. Ventricular rate is determined from the spacing of the QRS complexes because each QRS complex represents ventricular depolarization and normally corresponds to one ventricular beat. Question 136. The patient complains that it hurts when they swallow. This type of complaint is considered: option A, assessment. Option B, plan. Option C, objective. Option D, subjective. The correct answer is option D, subjective. Explanation. Pain with swallowing is a symptom reported by the patient, so it is subjective information rather than an objective finding directly measured by the examiner. Question 137. A pulse site used to measure blood pressure is: Option A, brachial, Option B, popliteal, Option C, radial, Option D, temporal. The correct answer is Option A, brachial. Explanation. The brachial artery is the standard pulse site used with a blood pressure cuff because the cuff is placed around the upper arm and the artery is assessed near the elbow crease. Question 138. What is the minimum number of electrodes that may be attached to the patient for Holter monitoring? Option A, 12 electrodes. Option B, 2 electrodes. Option C, 5 electrodes. Option D, 10 electrodes. The correct answer is Option C, 5 electrodes. Explanation. The source specifies 5 electrodes as the minimum for this Holter monitoring setup. The exact lead configuration can vary by device, so equipment instructions should be followed. Question 139. The term used to describe sophisticated and highly complex care is: Option A, managed care. Option B, tertiary care. Option C, secondary care. Option D, primary care. The correct answer is Option B, tertiary care. Explanation. Tertiary care is highly specialized, complex care that often involves advanced technology and subspecialty expertise.